Yeah, sure. I guess pain is tricky because we often grow up thinking that it's like a really accurate measure of tissue damage.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronsky, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Today's episode is brought to you by Curable. The Curable app provides a step-by-step chronic pain recovery program, complete with bite-sized pain neuroscience lessons, brain retraining exercises, meditations, and more. The Curable app has helped thousands of people overcome a variety of different chronic symptoms, including pelvic pain, through its evidence-based biopsychosocial approach. Click the link in the description below for your exclusive free 6-week trial to Curable's full healing program. In today's episode, we're simplifying the complexity of pain for kids and adults. The research tells us that the relationship between pain and damage is not very accurate, and everything and anything can influence pain, regardless of the state of the tissues. If maybe everything and anything can change pain, how do we do that? How important is language and modeling of pain behavior for kids who then grow up to become adults? And how might this influence the development of chronic pain? Where does pain science education fit in all of this? Dr. Joshua W. Pate joins me today to unpack these questions. Dr. Joshua W. Pate is a researcher of pain in childhood and related education. He is a senior lecturer in physiotherapy. Josh is also a children's book author. Zoe and Zack's Pain Hacks has just been published, and it's a series of 5 books covering the latest science about pain. We hope you enjoy the show. Josh, thank you so much for being on the show today.
Thanks for having me.
So let's dive into this topic around pain and the complexity of pain. As a researcher yourself, help myself and our audience unpack this complexity.
Yeah, sure. I guess pain is tricky because we often grow up thinking that it's like a really accurate measure of tissue damage and health. And if we have pain, that means there's damage, and if there's more pain, there'd be more damage. But what we see, and even in like really controlled lab studies, is that the relationship isn't that strong. And so, and then the latest kind of theory would suggest that pain is biological, psychological, and social. And maybe some of the listeners have heard of this biopsychosocial model. It kind of applies to all of health, but I think for pain specifically, it's helpful because it points out that even when you fall over and scrape your knee as a kid, like if your parents are watching, or if your teacher's there, or if you're trying to be cool in front of your friends, or like all these little tiny things, and if you've had it happen before, expectation, lots of things are going to play into how much pain you feel. And so I guess that is one part of the complexity. And that's something that really made me curious working when I first graduated as a physical therapist, as you call it in the States. And yeah, I was just like, how do we deal with this? How do we account for all of those other variables?
And it's interesting that you mentioned the context of learning about pain, like learning how we respond to pain or potentially noxious stimulus with other people around, and particularly our caregivers. I'm curious as to what research you know about or maybe have done about when our caregivers respond to children's, scraping of their knee, or when they're in pain. How does that then shape or shift the influence of that pain and that learning experience for them as adults?
Yeah, I think it has a huge influence, and there's lots of great psychologists working in that space of looking at the parents themselves and how does that shape, like their childhood experiences predict their adult experiences and things like that. And I think it certainly does. My particular research interest is in the language that gets used. And so if someone hasn't been given the vocabulary to express or communicate their pain, often you say, what's wrong? And it's just, I don't know. And I don't know, even now as a dad, you get frustrated. You're like, oh, just explain what's happening. And they can't localize pain until they're a few years old. And there's all these challenges as kids grow up. Their developmental influences are influencing their vocabulary. And then if they haven't had pain experiences or haven't observed that, it's a very different thing. Like we did a study with 8 to 12-year-old kids, and half of them had chronic pain experiences, present or past ones, and then half had never had any of those. And all of them drew injuries when we asked them to draw whatever you think of when you hear the word pain. But the kids with chronic pain also then drew like hearts and tears and sad faces. And it was like these emotional elements, the kind of, if you Google the word pain, like the suffering part of that definition, like that once someone has felt the suffering, the long-term suffering, that's how they define it. Whereas I think prior to that, or if they haven't had the chronic experience of a long-term horrible time, you think of pain, oh, it's quite helpful. Like if I put my hand on the hot stove, it gets it off. Those kind of things. Yeah. So I guess it's maybe that different. Some people think of it as acute versus chronic pain. But it like our system's kind of just changing in sensitivity all the time. And as time progresses, if pain persists, it definitely gets more and more wound up and more sensitive or excitable, whatever word you want to use.
Right, exactly. And this reminds me of a situation where in my profession, I specialize in pelvic health for male body, for penis owners particularly. And there was a mom of a little boy who reached out who had penile pain, and it was chronic. And it just, you explaining the language of like, how do we explain the inexplainable of like the sensation that's going on in our body, but then add to that the layer of complexity of the genitals and that part of the body. I can't even imagine.
And I think even like without the genital part, I think it's even really hard, because if a parent has a certain concept of pain, we've seen, like we've got data from last year at Stanford's pediatric pain clinic, and parents don't think the same way about pain as the kids. When they're, even after a 3-hour appointment with a health professional team, they're still thinking differently. And a lot of it is similar, but there are certain differences, and those differences seem to be the same things that the research is suggesting that the education would be helpful for. So maybe for that boy that you're talking about, he might think it's a really serious life-limiting thing. And then the mum might think a completely different thing. And the dad might think a completely different thing. And so for a health professional, it's like, where do you start? How do you know, like, whose story do you prioritize? And that kind of thing, I think, is a real frustration, because that's not in a textbook yet anyway. And that's really hard.
It is. And on that note, do you have any advice for all those individuals that you named as far as how to navigate such a complex conversation like that and situation, and help guide them in the best way possible that we know with what we know now?
Yeah, so I've been working on these children's books, which you just showed me that you have.
Hold on a second. Hold on a second. Zoe and Zack's pain hacks right here.
Yeah. So we've been doing research on these books and piloting them and developing them over the past like 5 years or so. And the language in that is very, very particularly designed. And even the way that it's laid out, and the story focused, and the characters are the main drivers, and all of that stuff. I think having a common vocabulary, and it probably needs to be like that lowest common denominator thing. Like you wouldn't want to go, all right, well, let's just use what the textbook of pain says. Like obviously you would use the simplest language. And so my personal hunch is that these kids' books will become the kind of common language that hopefully everyone starts using. And because we don't need to overcomplicate something that's already very complex. So it's, my kind of goal with these next 5 or 10 years is working out what's that minimal amount of intervention and education that we can give that then facilitates these conversations. Because I think, say for that boy that you mentioned, imagine he's getting home and he's like, oh, mum, I can't put on my undies, or I can't do that. Like my pain will stop me from doing that. But if the education, and there's been advice around how it is safe to move even if it is a little bit sore or something like that. Having that framework and everyone on the same page can make such a difference. And then if it's framed as like an active learning journey for the kid, then the parents and the coaches and the teachers, everyone around them just kind of becomes the cheer squad almost, and in a really positive way. Like it becomes very empowering for the kid rather than being told, what's wrong with you, buddy? And they're just like, I don't know. And they're unable to communicate. It's like, hey, you're learning so much and you're growing and you're changing all the time and your brain is amazing and all of that stuff. I think those messages have like subconscious positive effects as well as the obvious ones that you see when like the messages I get saying, oh, I love the illustrations or whatever. Yeah, I think there's something really exciting in that.
Wonderful. And speaking of the complexity and simplifying it for kids and their parents and caregivers and educators, etc. How did you manage that? I guess what was the process for you with Zoe and Zack's pain hacks? Because you really did take such a complex topic and really funnel it into the key target pain concepts of understanding. Can you walk us through that a little bit?
Yeah, sure. Maybe if we pick what, like say in the second book, the key message is many things can turn the volume of pain up or down. Yeah. So there's this idea that there's all these biopsychosocial influences that can turn the pain up or down. And my favorite study when I was working clinically prior to doing academia was, I love talking about this study. It's from the early 2000s. And basically people had a really cold metal rod put on their hand. It was like minus 20 degrees Celsius. So freezing cold. And they felt more pain in the presence of a red light in the room than in the presence of a blue light. And that just was mind-blowing to me. And it opens up all these possibilities. Like in the book, we say, if a little light can change the volume of pain, like there must be so much more possible in your brainy brain. Like that kind of fun exploratory idea of going, oh, like Zoe went and visited her smart grandma. We personified the authors as Zoe's grandma, being a science lab expert, superstar kind of person. And I guess, so it started with a scientific paper that has good scientific rigor and merit, and it's worth talking about as a clinician. And then it was like, well, you can't just say the results, oh, the confidence interval didn't cross zero. So like you can't say that to a kid, right? Like that doesn't make sense. So it's like, okay, let's build this into a narrative and let's make this rhyme. And then we did, there were several ideas. And then we piloted one of the books and compared it to a sham book. So I've worked on with TED Ed on some animation videos, and they let me use the images. So both books had awesome pictures. They both rhymed, but one just explained how to rate pain out of 10. And then the other book explained this message of pain doesn't mean damage, or it doesn't necessarily correlate with damage. And what we did was give them, it's called a SCED study. It's a complex methodology, but the idea was kids got to act as their own control group. And we saw that the language that they use is different once they receive the intervention book. And the number of times they're reading the book it's more engaging. And the way that they think about pain also changed in the interview following the real book rather than the sham book. And so I guess a lot of data has driven what ended up being in the book, because that was a couple of years ago now. Like we're still writing up the paper, but the books changed a lot because of that. And it meant, so we initially had that qualitative study where we got the kids' language, and then we used that in the books combined with the scientific papers. And then we grabbed all of that stuff, made the stories. Then we've been testing that. And I guess it's those iterations, like all the co-design is all the rage at the moment. And like, it's for a good reason. Like if you get kids to be a part of the design, it's way funnier. Like there's all these jokes. The second time you read the books, like if you're looking out for dogs, there's dogs everywhere. And then there's like little Easter eggs and things. And yeah, if you just didn't have kids involved in that, the books wouldn't be as like, they wouldn't want to come back as many times as what I am hearing that they do so far. Does that make sense? Have I answered your question?
It totally makes sense. And I just want to just again, because you referenced the second book in your 5-book series. Here it is, as far as lights up. Zoe Zoppins lights it up. And this is the particular study and section around
There it is. Yeah.
there it is, around the red light and the blue light and the cold rod. Is brilliant. It is absolutely brilliant. The linguistics, how intentional, how purposeful everything has been. I mean, you can't miss it. And it's just such a wonderful, not just for kiddos, but also for adults. I have found, and I have to say that it's it really does help bring that narrative to light for someone, and understanding it in the most simplistic way. And as an educator myself and clinician, this is just priceless to have as a resource in my back pocket, to say, you're feeling really overwhelmed today. This might seem really silly. Just take one of these books. It seems like a kid's book, but it's packed with life-changing information. Are you willing? Are you willing to kind of take this book for a ride, because it's simple, it's easy. And I don't have to tell you this, but the overwhelm, even the ability to concentrate and process new information and learn is really difficult with chronic pain. And so having this and saying, like, this might be silly, it's got some images, it's a cartoon, think of it as a comic book, just go through it and let me know what you think, so simple.
Yeah. And that idea of kind of lowering the bar for entry, like that was one of the main criticisms of this pain science education type work, is not everyone needs to become a scientist to get better. And I totally agree. And so that's why it's 5 separate books. Like maybe there's a specific gap or a specific misconception that you identify clinically, and then you can start there. And so you're taking them on a patient-led journey. Like you're there with them, but they're kind of guiding the process. And I think that's so powerful. Like, and even when we were up to the very first book and I was working clinically in an adult pain clinic, the non-English speaking patients and like who speak a tiny bit of English, and the patients who are on high doses of medications like Lyrica, where they have brain fog, kind of like what you were mentioning, they really liked the kids' book idea, because it's like, oh, okay, well, I could get this because a kid understands that. Like it just has the perception of, this is possible. Whereas sometimes if you show a video of a scientist, or if there's just other resources out there that are brilliant and accurate and true. But I think what sets this apart and what we're seeing is that it's that accessibility. Like it looks like a mainstream pop culture book kind of thing. Like it just, you want to read it and check it out, and kids want to keep reading it. And I think that's the other thing that's really exciting, is like I've done some work with amazing animators and done online things, but kids, the video reading of the book in the studies, they only watch the video once. Like that was the maximum number of times someone engaged with the book. Whereas if they had the physical copy, it was like 2 to 4 times in a week period. Like it was so much more. And this is a small study and it's an early thing, but to me, like, and it makes a lot of sense, even just with I've got a 5-year-old and seeing her children's book, you keep coming back every bedtime. It's like, oh, what are we going to read tonight? Like, and I think that is, there's something there. Like hearing the same key messages over and over helps it to stick a bit deeper, because for a lot of people, they hear the message, oh, feeling pain, like even a light can change the experience of pain. Wow, that's crazy. And that's it. They leave it as a fun fact. And they don't apply it to their life. And so at the end of each book, we've got these interactive questions, and then it takes you to an online platform, and then you can print stuff off, and there's worksheets. And all of that stuff is built to try and engage actual behavior change, not just, we don't want to just change the way you're thinking or just provide language. Those things are great. And I do want to do those things, but we also want to see actual change in improvements in life in a long-term capacity, not just short-term. Yeah.
Right. And thank you for bringing up that very important point of how do you apply this information practically? Otherwise, it's just a dump of information that is meaningless without the experiential discovery of, wow, actually, this is really true, and gaining some conviction about this education and this knowledge that then really transforms into something powerful. Because once you really gain that conviction, it's really hard to take that away. You know, a really strong belief in something is very challenging then to kind of just, it's not so wishy-washy anymore.
Yeah, that's right. And the kids really relate to the characters. And so in the fourth book, Zoe's cousin Zack is looking back and being like, hey, I'm back at school. Like my back pain isn't interfering in my life anymore. And Zoe's just they're playing in the backyard, dressed up and being silly. And she's just like, how did that happen? Like, I've got tummy pain and it's not happening for me. And then he talks about how he did graded exposure and pacing and some of the strategies in a kid-friendly way. And then in the fifth book, it fast forwards and you see Zoe looking back 7 weeks into her action plan. She's not completely recovered or anything yet, but she's now, the things that were triggering her, like public speaking and getting teased and all these different moments. We walk through a typical day, like she's at soccer training, all these things where her tummy pain would have flared up and now it's not. And then you're left with the readers kind of left going, well, what did she do? And then you fold out and there's like 50 something strategies she's been implementing consistently for 7 weeks. And you start seeing that, hey, Zack did it that way, Zoe did it that way. And then Zoe turns to the reader and says, like, what's your action-packed action plan going to look like? And I think that's where the rubber hits the road for me. Like, that's the moment for a kid where it might be 4 or 5 sessions into seeing them, where the parents just like, okay, I think they've got it now. Like, they've read that fifth book a few times and they want to make their own plan. Like, can we do that in the next session together? That moment is really nice, I think, because that's going to be stuck on their wall. That's going to be the thing that they refer to as like that anchor of, that was when I that was when I returned back to school, or that was when I started playing sport again. And it really empowers those small, accumulating small wins, like those small behavior changes.
Yeah, and how it just really blends into these are life skills. These are life skills of resiliency and mental flexibility, and that they can pass along to others. And it's kind of like you're planting seeds with these books, you know, all over the world.
Yeah,
planting seeds.
That's awesome. I'm so glad you've spotted that, because we're doing, like, I have a PhD student who we're going into schools and teaching teachers, like, hey, if danger outweighs safety, it makes sense that there would be pain in the classroom. And then they like, straight away, they're already thinking biopsychosocially, but they don't have the language. Like, they're teaching well-being and resilience. They know this stuff. But they go, oh, that makes sense. Like, all the kids that's when they have their tummy pain, when there's a maths test. And you're like, oh, okay, yeah. And so we're just in such early days of this preventative type education being tested and to see if it's effective. Like, I think it has the potential and it makes logical sense. But we haven't tested to see if someone learns this at, say, age 8 to 10 and they don't have chronic pain, does it prevent pain-related disability or something like that's kind of where we want to head down the track. And I just think of my experience as a kid. I didn't have chronic pain, but like the statistics show that there's a couple of kids in every classroom on average who have it, and it's invisible and it's impacting on their life. And I reckon a lot of the stigma and a lot of these other issues around how it's managed in a class actually could be addressed with this kind of education as well. Like, if everyone knew that it was really burdening them and that there's support out there and that multidisciplinary care is good and those kind of things, I think there would be that, like, I reckon I would have been a nicer person. I don't know if I can't remember if I was nice or rude to anyone in particular, but
right now.
but like, I'd imagine there's this increased empathy, maybe, like, of going, hey, this is really complex. Like, when you see someone crying, it's like, wow, those feelings are really complicated. I wonder what the web of complexity is underneath those tears. Rather than being like, oh, why are they crying again? Like, it's such a different reaction as someone kind of just observing. And then I think if you saw that managed well, then you would, like, if I was to develop pain for a few months or something, the chances of me then having days off work or from school or whatever it was would be less, because you would realize that the behaviors are influencing the future outcomes. And And some of that stuff like kind of will naturally flow. Like, as you say, planting seeds is kind of, that's the dream, right? Like, I haven't shared this whole lot yet, but that's where we're heading with our research. Is we want to test this and see if there is merit in this kind of hypothesis.
Well, I'm glad I went there, because that was actually my question of like, where do you see this heading and what's the future like for this research and these books? And I think you really nailed it.
Yeah, it's a really exciting time. And I think there's more and more teams working on this around the world. And I think I just want to highlight that it's not my books. Like, there's so many people who have contributed to this project in particular. But then also, like, the future of research is not in one person or one team. Like, there's so many people that need to work on this. And what we're seeing, even like in one of the studies we're doing in Australia, is different school systems are able to implement this kind of education in different ways. Like, sometimes it's in the health and well-being curriculum, and sometimes it's in the neuroscience in early high school. And like, that's going to be different in different cultures. That's going to be different in different countries with different languages. Like, there is so much work to be done. And so I guess to answer that future question, it's like, there is a million options, and maybe all this AI will help us or something.
Yes. Oh, speaking of different languages and cultures, and forgive me for my ignorance if I don't know, but are the books there? Are they just in English, or are you planning to have?
At the moment,
Okay.
yes, I would love that. And there's people emailing me, and I am the instructions I've had from the publisher is just let us know if people want to translate it. And it kind of, I think it costs a lot to produce books, like, from a publisher's point of view. And so to make a new language or whatever, they really would need like the what do you call it? Like the market need or whatever, really obvious. And so there's a bunch of people kind of lined up for different languages, but it hasn't started yet. And I'd imagine just people doing it informally is kind of the starting step. And I guess this may be a good moment to mention, we built an online portal like that relates to the books, and that's freely available. And people are translating some of those worksheets and stuff like that, because it's just like a couple of sentences. It's not a whole resource that rhymes. And I'm so excited about that, because as the evidence changes and as we learn more about these key messages and what's most beneficial and all of those things, we can keep updating it. And so you finish reading a book, you scan the QR code, it takes you to the website, then there's videos, and then for clinicians, there's all the evidence behind the books. And for the parents, there's instructions and some facilitating kind of questions. And for teachers, there's like lesson plans. And then for the kids, there's just more activities, like heaps more fun stuff. So I think that this kind of back and forth engagement in resources will be the future, from what I can gather. But yeah, I'm really excited to keep developing more and more hopefully helpful patient resources and testing them out in my research. So yeah.
Oh, that's wonderful. And we'll be sure, Josh, we'll share that link and have it in the show notes so people can access it readily, the online portal that you're talking about.
Yeah, cool. It's just Zoe and Zack's painhacks.com. Yeah.
Awesome. Well, speaking of other resources, I know you had mentioned a couple of other resources other than the book and then the online. Anything else that you'd like to share with the audience as far as resources and support?
Yeah, I mean, it's funny working as a researcher, like you spend years on a paper and you publish it, and then like a couple of thousand people maximum sort of read it within that first little period. And whereas if you're developing a resource, it's like you're on the radio and it's going out to the masses. And the first time I experienced that was working with TED Ed on an animation, and it like I've done 2 of them now, and it's just millions of people see this. And so I think that's like a whole nother level of engagement. And that, like, say the Mysterious Science of Pain video, I think that's in like 13 languages, and that's been seen so many times, and not just in clinics or in houses or in schools, or like it's in hospitals and in academic settings. And I think that's probably the video, that the resource that I've been a part of where I get the most random, like, cold emails from, and that's really exciting. So if anyone's listening, I'd love to hear from you. I find it very encouraging. And yeah, I guess there's a bunch of resources on my website that are set up. There's just kind of lists of links and videos and things, podcasts like this. Yeah, I think it'll be an ever-growing list. And as the number of people working in the field, there'll be better and better resources available. And I'll be spruiking for whatever is out there and is best. So it's an exciting time, I think. I think we have more reason for hope about chronic pain than we've ever had in terms of the science. Yeah.
I agree. I agree wholeheartedly. Absolutely. Josh, thank you so much. One last question as far as where you live on the social media platforms, if folks, clinicians, anyone listening or watching this wanted to connect with you.
Yeah, if you just type in Joshua W. Pate, it will come up most. So I post academic-ish stuff on Twitter primarily. Instagram is more directed to families and clinicians and kids. And then LinkedIn is I guess I also have that. I teach at a university, the Masters of Physio program. So that's kind of there. So I'm around, I'm available. I haven't gotten into the those other platforms where people are scrolling every 3 seconds. I don't know how to engage someone in 3 seconds about this stuff. So if anyone has ideas or wants to launch a TikTok for me, happy to. I don't really want to do it.
I hear you on that one. I refuse to jump on ship on that. I'm done. I'm done. We go. Yeah, YouTube and Instagram is enough for me. It's more than enough at this moment. Well, thank you, Josh. Again, thank you so much for being on the show, and we'll make sure to link the Mysterious Science of Pain, your videos, your website, Zoe and Zack's Pain Hacks, everything that you've mentioned here. We will definitely link to the show notes and the description below in the YouTube video. So much appreciation for all the work that you have done in collaboration, certainly with many other mentors and giants that we ride on the shoulders of. So I really thank you so much for changing the world. I know you have really, really supported my practice and helped in so many ways. So thank you.
Oh, thanks, Susie. And likewise, thank you for doing what you do. I think you do a great job promoting evidence-based stuff online, which is great too. Thanks.
Thanks. And to all of our viewers and listeners out there, thank you so much for watching and being here. As always, in loving wellness for your pelvis, this is Dr. Susie G. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.